Brain tumors. Brain tumors are abnormal growths of cells within the brain. These tumors can be either benign or malignant. Benign tumors are non-cancerous and grow slowly. Malignant tumors, on the other hand, are cancerous and can spread to other parts of the brain or spinal cord. Brain tumors can arise from different types of cells within the brain, including neurons, glial cells, and meninges. The specific type of cell from which a tumor originates determines its classification and behavior. The development of a brain tumor can significantly impact brain function. Depending on the tumor's size and location, it can press on vital structures, leading to a variety of neurological symptoms. Recognizing the symptoms. The signs and symptoms of a brain tumor can vary depending on the tumor's size, location, and growth rate. Some common symptoms include headaches, especially those that are worse in the morning or wake you up at night, seizures, which are caused by abnormal electrical activity in the brain, weakness or numbness in the arms or legs, which can be a sign of tumor pressure on the motor cortex, difficulty with speech, balance, or coordination, indicating involvement of areas responsible for these functions. Vision changes such as blurred vision, double vision, or loss of peripheral vision, suggesting pressure on the optic nerve or visual pathways. Personality changes or cognitive impairment, which can occur if the tumor affects areas of the brain responsible for these functions. It's important to note that these symptoms can also be caused by other conditions. If you experience any of these symptoms, it's essential to see a doctor promptly for a proper diagnosis. Early detection and diagnosis are crucial for improving treatment outcomes. The exact causes of brain tumors are not fully understood. However, research suggests a complex interplay of genetic and environmental factors. Genetic predisposition. Certain genetic syndromes, such as neurofibromatosis and tuberous sclerosis, increase the risk of developing brain tumors. Exposure to radiation. Exposure to high levels of ionizing radiation, such as that from radiation therapy or atomic bomb explosions, is a known risk factor. Environmental toxins. Exposure to certain chemicals, such as pesticides and solvents, has been linked to an increased risk of brain tumors. Research is ongoing to identify specific genes and environmental factors that contribute to brain tumor development. Understanding these factors is crucial for developing effective prevention and treatment strategies. Brain tumors are broadly classified into two main types, benign and malignant. Benign brain tumors are non-cancerous and grow slowly. They tend to remain confined to a specific area of the brain and rarely spread. While benign tumors are generally less aggressive, they can still cause symptoms by pressing on surrounding brain tissue. Malignant brain tumors, on the other hand, are cancerous and can grow rapidly. They can invade nearby brain tissue and spread to other parts of the brain or spinal cord through a process called metastasis. The treatment approach for brain tumors depends on several factors, including the tumor's type, size, location, and the patient's overall health. A primary treatment option. Surgery is often the primary treatment option for brain tumors, especially for benign tumors and malignant tumors that are accessible and have not spread. The goal of surgery is to remove as much of the tumor as possible while preserving surrounding healthy brain tissue. Advances in surgical techniques, such as image-guided surgery and minimally invasive surgery, have significantly improved the precision and safety of brain tumor surgery. These advances allow surgeons to operate with greater accuracy, minimizing damage to surrounding brain tissue. Radiation therapy, targeting tumor cells. Radiation therapy uses high-energy rays to damage and kill cancer cells. It is often used after surgery to target any remaining tumor cells, or as a primary treatment option for tumors that are not surgically accessible. Different types of radiation therapy are available, including external beam radiation therapy, which delivers radiation from a machine outside the body, and internal radiation therapy, also known as brachytherapy, which involves placing radioactive material directly into or near the tumor. Radiation therapy can have side effects, such as fatigue, hair loss, and skin irritation. However, these side effects are usually temporary and manageable. Section 7. Chemotherapy and beyond additional treatment modalities. Chemotherapy uses drugs to kill cancer cells. It can be administered intravenously or orally. Chemotherapy is often used in combination with surgery or radiation therapy to treat malignant brain tumors. Targeted therapy is a newer type of cancer treatment that uses drugs to target specific molecules involved in cancer cell growth and survival. Immunotherapy is another promising area of cancer treatment that harnesses the body's own immune system to fight cancer cells. Clinical trials are research studies that test new treatments and therapies for brain tumors. Participating in a clinical trial can provide access to cutting-edge treatments and contribute to scientific knowledge. Section 8. A beacon of hope, advances in treatment and research. Significant advances have been made in the treatment of brain tumors in recent years. These advances have led to improved survival rates and better quality of life for patients. Ongoing research is focused on developing new and more effective treatments, such as targeted therapies and immunotherapies. Researchers are also working to identify new biomarkers for early detection and personalized treatment approaches. While brain tumors remain a complex and challenging condition, advancements in treatment and research offer hope for the future. With continued progress, we can strive for better outcomes and improved lives for those affected by brain tumors.